When it comes to medicine, treating mental health in kids has got to be one of the toughest challenges out there. So, for a condition like bipolar disorder, how does a clinician even begin to choose the right path? It's a really complex process, but it all comes down to a careful, structured approach. Let's break down how they make that critical choice.
Okay, to really get a handle on this, we have to start with a pretty surprising fact. Get this. 1 in 5 prescriptions written today are for what's called off-label use. That's a massive number, and it points to a common practice that's absolutely central to pediatric mental health, but one that a lot of people don't really understand.
So, what does off label actually mean? Well, it's pretty straightforward, really. It's when a doctor prescribes a drug for a condition or for an age group or even at a dose that's different from what the FDA originally approved it for. And this is perfectly legal. And as we just saw, it happens all the time.
And this is why it's such a big deal when we're talking about kids. See, a lot of the most effective mental health medications were only studied in and approved for adults. Running those huge clinical trials on children brings up a ton of ethical and practical challenges, so there's just less direct data available. So what does that mean? It means when treating a child, clinicians have to use their expert judgment to adapt these treatments. And this is really where their methodical process begins.
So, faced with all this, a clinician isn't just throwing a dart at a board, right? They have a toolkit, a really structured 3-part approach to make sure every single angle is covered before they make a decision. So what's in this toolkit? Basically, there are 3 core options they have to consider. First up, is there a drug that's specifically FDA approved for this condition in children? Second, could a well-researched off-label medication be the right move? And third, what about options that don't involve drugs at all, like therapy?
Let's break that down even simpler. You've got 2 medication-based routes, one that's officially approved for this specific use, and one that's approved for something else. Then you have the therapeutic route, which isn't about medication at all. We're talking about things like cognitive behavioral therapy or family counseling. Every one of these has to be on the table.
Okay, now we're getting to the real heart of the matter. With those options laid out, the clinician starts a formal risk assessment. And this isn't about a gut feeling. Nope. It's a very formal, very methodical balancing act for every single option. Which leads us to the big question, right? With all these different paths available, how in the world do they actually make the final call? Well, it all comes down to a super rigorous evaluation of each one. Let's start with an FDA-approved drug. Here, the process is pretty straightforward. They dig into all the clinical trial data. What are the known side effects? What are the potential benefits? This gives them a really clear risk versus benefit profile for this specific choice. And here's the really important part. They apply that exact same discipline process to the off-label option. They look at all the potential risks, which, might have a little more uncertainty, and they weigh them against the potential benefits, which are often backed up by really strong studies in adults. But wait, how do they make sure this assessment isn't just a guess? They're not working in a vacuum. The clinician's compass here is evidence. Every single decision has to be backed by credible, up-to-date information to make sure it's the safest and most effective choice possible. This right here, it's the bottom line. It's totally non-negotiable. Every single recommendation, whether it's on-label, off-label, or therapy, has to be justified. They have to be able to stand there and say, here's why I chose this treatment, and back it up with solid proof. So where are they getting this proof from? Well, there's a kind of pecking order. They always start with the official clinical practice guidelines. From there, they look at any studies done specifically on kids, then research from adults that can be applied, and finally, they have to pull in recent scholarly articles to really seal the deal. Okay, so after all that, after digging through the toolkit, weighing every risk, and checking all the evidence, all those pieces finally start coming together. This is the synthesis, where all that deep analysis turns into a real action plan. And after all that incredibly detailed work, the whole process, everything we've talked about, it all comes down to just one thing. The number one, a single customized plan for one individual patient. It's the ultimate reminder that there's absolutely no one-size-fits-all in pediatric mental health. And that's the key takeaway here. The final choice isn't just picking option A, B, or C from a list. It's the end result of a truly comprehensive process that combines all of these factors to create one personalized recommendation for that one specific child. And all of this leaves us with a really important question to think about. Knowing the immense pressure and the incredible expertise this whole process demands, how can we, as a society, best support the clinicians who are making these critical,
often life-altering choices for our kids every single day.